we mentioned, we have a topic of a more serious nature now. It's prostate cancer. Few symptoms, slow growing, often deadly. Almost 250,000 men in this country will be diagnosed with prostate cancer this year. In fact, it's the second most common cause of cancer death after lung cancer in men. So here's the question: who's vulnerable? Can it be prevented? And why do all men over 50 need to know about a blood test called PSA? We get some answers now from urologist Dr. Matthew Whang. Welcome, Dr. Whang. I got the facts right. I saw you over there noticing, nodding as I was going along, and it's very scary because, again, more attention, fortunately, is being focused, but it's such an insidious disease.
Yeah, prostate cancer has almost no symptoms in and of itself. Many men really don't know they have prostate cancer until sometimes it's too late. With the advent of this test called PSA, we have been able to detect it much earlier than we have in the past. And I am happy to say that I think with PSA and early diagnosis, we're able to offer early diagnosis and therefore cure. A chance at a cure. Cure
is worth talking about.
It's absolutely.
We're going to get in more specifically into PSA. I want to get real specific about, if you don't really know how the prostate works and who is likely, again, to have this problem. Let's talk first about the recovery rates. What are we talking about with this disease? Is it almost always fatal, or how?
Prostate cancer will depend on when we find it and where or how far it has spread. If the prostate cancer is found within the prostate gland, and we are able to perform surgery or radiation therapy, we can cure them in 80 to 90% of cases.
80 to 90% of cases?
If, however, we find it too late, it's already gone into the bone or lymph glands, then chance of cure is relatively non-existent, I would say.
Let's make sure people are clear on where the prostate is, what it does. It has to do with the production of sperm, yes?
Yes, it does. Prostate is an organ that is found in every man. It's located between the bladder and the penis.
Yes.
And it contributes to seminal fluid. And it's an absolutely necessary organ in all men. And unfortunate thing about the prostate is that as we get older, it gets larger and cause voiding symptoms. And it can also develop prostate cancer. And that's where
it's just susceptible to that. So one of the key symptoms, this is where we're talking a few symptoms usually, but one of the things that sends them to your office, what do you see?
Some patients will complain of having to go to the bathroom frequently, waking up at night a couple of times to urinate. These are actually more signs of benign enlargement of prostate. But when we examine these patients, often we'll find that some patients do have prostate cancer or are suspicious for having prostate cancer. And we therefore evaluate them further with a biopsy and blood tests, and we can then treat them appropriately.
Yeah. Now, is there a profile of the most susceptible kind of, is there a race or?
In this country, I would say everyone is equally susceptible. One of the interesting things that they have noticed through studies is that the people in Japan tend to have fewer incidents of prostate cancer compared to Americans. However, the Japanese who have been living in this country all their lives have almost same rate of prostate cancer as regular Americans.
Something to do with the environment.
Absolutely, it does.
Hold on for a second, Dr. Whang. We're talking about prostate cancer and treatments. We'll talk more in just a moment. Talking with Dr. Matthew Whang about prostate cancer. It is a very serious ailment that is showing up more and more for reasons we're not sure of, but it certainly is. It is gender linked, but not available only to races or creeds or anything. It has to do certainly with something in our diet, possibly. We're not sure of all the reasons. So we're talking today about possible treatments and preventive measures. We're also talking about how any man over 50 has to think of this like a woman thinks of a mammogram. Yes, Dr. Whang?
Yes, absolutely. People have stated that up to 1 in 10 men in this country will be diagnosed with prostate cancer at some time, which in epidemiologic terms is quite similar to the incidence of breast cancer in women. So I think it's very important for all men, starting age 50, should have a blood test called PSA and a rectal examination and be evaluated for possibility of prostate cancer.
So let's talk about PSA. Now, this is the prostate-specific antigen. That's what it stands for.
Correct.
It's only found in the prostate gland.
Correct. Prostate PSA is a protein that's found only and produced only by the prostate gland. Unfortunately, it's not cancer specific. It's specific for the prostate gland, but not for the cancer itself necessarily. So if you have a very big prostate, or if you have an inflammation of the prostate, or if you have prostate cancer, this can be abnormal. But patients should still have a PSA test once a year, starting age 50, so that we can tell where we are. If PSA is very high, normal is up to 4. If it's, say, 20, I'd be worried that there might be prostate cancer.
That's a high level.
That's very
I see.
high,
Yeah.
yes.
Now, this is in conjunction with a rectal exam?
Absolutely. There are times when we have a perfectly normal PSA with a very abnormal rectal exam, or vice versa. So we use both of them. One of them alone just isn't enough. We use both of them, and that can really help us identify those patients who have or who probably does have prostate cancer, and then we can diagnose them early and then treat them appropriately.
Understood. Call from Lawrence in Florida. Lawrence, your question?
I had 2 physicals, I had two PSAs. Your urologist examined me, and I had 8 biopsies taken, and it was non-malignant. I'm 75 years old. I just went for another physical, and I have a 7, and I was wondering if I had anything to be concerned about at this particular time in my life.
The fact that you have had a PSA and an exam by a urologist is very good. If your biopsy has been negative, I think that's a good sign that there probably is not prostate cancer that we can find at this point. What we recommend in patients like that is to continue to monitor their PSAs on a regular basis. Depending on how high it was initially, they may check it as early as every 3 months or every 6 months or even every year. And if the PSA starts going up or doing, changing things, then I think you may need another biopsy at that point. But that'll be something that you can discuss with your urologist.
I think this leads us right into the discussion of treatment, Dr. Whang, because we were talking about some major ways that you sort of look at this disease. Some are more radical than others, which we'll speak about in a moment. But perhaps Lawrence is talking about what you call watchful waiting, because the Journal of American Medical Association, I should just mention, it was on the wires today that they're reporting the best treatment for elderly men with slow-growing prostate cancer might be no treatment at all. This is what you call this watchful waiting.
Yes,
what does that mean?
Well, watchful waiting means that because first of all, prostate cancer treatment should be tailored to the patient's overall health and their age and exactly where the cancer is. If the cancer is organ confined, that is within the prostate gland only, and it's a slow-growing cancer, we can tell by looking at the slides of the cancer and seeing how aggressive it looks. If it's not very aggressive and the patient is older, say 75 plus, I would say, then I think chance of that cancer causing any harm to that patient is almost negligible. So in that case, we can say, let's just wait and see what happens. However, in the younger patients who are 50, 55, waiting next 20, 30 years, wondering, is this going to ever catch up with me, I think would drive anyone nuts. And in those patients, I think it's very important to go in and treat them as aggressively as you can in an effort to cure the cancer.
Also, because you were saying your patients, when you tell them, well, we just should watch and wait on this, it's too frustrating.
Yes.
They want to be proactive about the cancer.
It's hard for Americans to understand, sir, you have cancer, but we're not going to do anything about it. People just can't deal with it. I don't think I can deal with it personally if it ever happened to me. But our studies have shown that patients who are older, 75 or older, there's really very little chance that that prostate cancer is going to cause a major harm in that patient. So in that patient, we can avoid the major risks and side effects of surgery or radiation therapy.
Understood. Let's talk just briefly about that, and then I have an audience question. The most extreme, obviously, would be to remove the gland itself.
Correct.
That would be the surgery. And then follow that with chemotherapy or radiation?
Actually, no. The surgery is called radical prostatectomy, and we remove the entire prostate gland. Presumably, when you do that, you're attempting to cure the patient. And when we're successful, they don't need radiation or hormonal therapy after that, unless there's evidence of recurrence at a later date. And the surgery can be quite demanding. It may take 3 to 4 hours to perform, but it's still the single best chance at a cure. So in my young patients who have 15-year plus life expectancy, I recommend strongly the surgical treatment.
But now, where does impotence come in after that?
Okay, with surgery, there are significant side effects, including impotence and incontinence.
And incontinence.
Yes, they can both occur. And that's why we don't take surgery lightly, and we don't recommend it to everyone. There are techniques that we use now in an effort to prevent impotence, but it can still occur, and that's something that we have to watch.
Techniques after the surgery to try to prevent.
No, actually, at the time of surgery.
At the time of surgery?
What Walsh from Hopkins have found is that the nerves that control potency happen to reside just under the prostate gland. And years ago, when we didn't know that, we often cut those nerves. Now that we know it's there, we take an effort to preserve that area such that the nerves are intact and the patients can have potency afterwards. So we are taking efforts, but the potency rate can vary between 50 and 70%.
It's a very important gland as relates to sexual potency, as you said.
Yes.
Got an important question from Pat in Texas. Pat, sorry to keep you waiting.
Oh, hello.
Hi.
I wanted to know what my husband can do. He had the surgery and he had the nerve-sparing technique done, but it's been almost a year, and he still has no sexual functioning.
This is what you were just
that's
speaking
exactly
about.
what I was talking
Nerve-sparing,
about.
they call it?
Right. We try to preserve the nerves, but sometimes it doesn't work. Sometimes the nerves were injured inadvertently, or possibly from psychological reasons, or possibly because blood circulation is different now that the prostate is no longer there. Some patients can become impotent despite our efforts at nerve-sparing surgery. In those
Anything we can do, yeah.
Absolutely, there are. You should go see a urologist who can offer you the treatment options for impotence, including vacuum device, injection therapy, and penile prosthesis. There are many ways we can deal with this, and it's not as bad as one may think. It's something that we can help people with.
Pat, are you still there? I was hoping she was. Pat?
Yes.
Oh, good. I wanted to ask how your husband's dealing with this, and you as well, emotionally, though. Have you tried any of these other treatments, and how are you feeling about it?
Well, he's tried the cream. There's a cream you can use, and it doesn't always work, and so it's sort of frustrating.
Yeah, I
so
can
we're both
imagine.
frustrated.
Yeah. And emotionally, again, is he depressed about it?
He doesn't talk that much about it.
That's another issue. I think he needs to talk to a urologist who understands what's happened, presumably his urologist who performed the surgery. And there are many things we can do. The vacuum device and injection therapy, they're wonderful. And I have several patients who have been very happy with the result after they've been treated by us for that.
Yeah, Pat, you're going to have to try a few more things. I really wish you well on this, because that's got to be awfully frustrating, very scary. But I hope the cancer is in check, right? They're not seeing any other evidence?
That part is very good.
Well,
That's
we're glad to
great.
hear that.
That's
That's good,
great,
so it
yes.
worked. Let me get an audience question, and then we want to talk about saw palmetto, which we hear a
Okay.
lot about. Audience?
I had a question that I had a prostate removed about 3 years ago, and it was proven benign. I'd like to know what would be, in the future, any results or any side effects.
If you're not having any side effects now, I don't think it's anything to worry about. When they removed the prostate, it was presumably for its blockage and symptoms. And unfortunately, when we do that, we don't take the entire prostate out, so it may regrow and may lead you to have more symptoms in the future. You should still be checked once a year with PSA and rectal exam to make sure that prostate cancer does not develop, because it can still occur, despite the fact that a good portion of prostate gland was actually removed.
Well, lots to learn on this. One thing I mentioned, saw palmetto. Now, this is an herb that a lot of men are being encouraged to take because if they have the urination symptoms, tough urination, then they seem to be relieved of that problem. Your thought on that?
I've actually had a couple of patients who came to me with symptoms of difficulty voiding, getting up at night to void, and I've offered several medications to them, and they said, well, a friend of mine gave me this and it's been working wonders. I say that's great if it works for them. I have not seen any scientific studies to suggest that that will do better than some of the medications that we have available, that I know works from clinical experience and from scientific studies.
So you would reserve judgment on saw palmetto
Yes,
until
I
you
would.
see some of the clinical studies on
Absolutely.
it. All right. Excellent information. We appreciate it, Dr. Whang, and the work being done down at the Livingston Center. It's the Men's Sexual Health Center, and they do incredible things down there. We always
Yes, we
learn a
do.
lot when you come to visit. Thank you
Thank
again.
you.
Thank you so much.